Good afternoon and welcome to the daily briefing at St. Clair County EMA where Sam Behrman will give us today's numbers. Sam?
Yes. So as of today, St. Clair County, we have tested 76,737 residents, which is an increase of 611 from yesterday. We are at 6,806 positive test results, which is an increase of 56 from yesterday, and that does include both males and females from under the age of 1 up to their 90s. Our daily county positivity rate is 9.2% today, and we are at 69,930 negative test results. Unfortunately, we are announcing one new death today, which does bring our total to 182. That was a male in his 80s who had unknown health conditions, and as always, our sympathies go out to his family. For those who have completed the IDPH required 10-day isolation period, we are at 6,078. For state totals, 4,863,138 have been tested, and 266,151 positive test results, which is an increase of 1,941 from yesterday. And for deaths, the state is reporting 8,367, which is an increase of 35 from yesterday. For hospitalization numbers for St. Clair County, currently 36 patients are admitted due to COVID-related reasons, and 4 of those individuals are on ventilators. And regionally, our hospitalization rates are 80 patients that are admitted due to COVID-related reasons, and 8 of those individuals are on ventilators. For our congregate living facilities that are in outbreak status, which is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, we will only announce any facilities that have had changes. The first, Aperion Care Center in Mascoutah, has 6 cases and no deaths, which is an increase of 1 case. Bradford Place in Swansea has 5 cases and no deaths, which is an increase of 1 case. Caritas Family Solutions in Belleville has 34 cases and no deaths, which is an increase of 3 cases. Integrity Healthcare in Smithton has 43 cases and 1 death, which is an increase of 15 cases. And Swansea Rehab and Care Center has 42 cases and 8 deaths, which is an increase of 1 case. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. So we'll move into the zip code report. As we have been doing lately, we're only going to read the zip codes that have changed since yesterday. Remember, these are COVID positive diagnoses numbers in these particular zip codes, cumulative since we started keeping track, which was how many days ago? 187 days?
187.
187 days ago. So we'll start with 62203 today. They went up by 1 to 197. 62205 went up by 2 to 193. 62206 went down 1 to 426. 62207 went up 3 to 242. 62208 went up 3 to 413. 62220 went up 2 to 536. 62221 went up 6 to 638. 62223 went up 3 to 389. 62225 went up 1 to 31. 62226 went up 8 to 702. 62232 went up 2 to 188. 62239 went up 1 to 98. 62243 went up 6 to 103. 62254 went up 6 to 245. 62258 went up 2 to 182. 62260 went up 2 to 133. 62269 went up 4 today to 529, and 62285 went up 2 to 83. The daily county positivity today is 9.2%, 56 new out of 611 tests, but the 7-day rolling average is 7% today, so we still remain below that 8 level and have for, I guess we're on about day 18. So that's good news. Team St. Clair out there working to make sure that 7-day rolling average remains where we want it, or at least as low as we can get it for now. The regional positivity, according to the state, is down today to 8.9%. But I have to say that number is going to go up again, given the other parts of Region 4. And if you listen to the numbers today, Bond County was at 26.2% positivity. Clinton was at 17.4% positivity. Madison, 12.2%, and these are case positives. Monroe County's at 53.3% positivity. Randolph is 14.3%. St. Clair, we're still the lowest with 12.1 positivity according to the state. And of course, Washington County, again, is up there with 41.2% positivity today. So the rest of the region is causing a rise in that positivity number. We hope they're out there doing what they're supposed to be doing. But if the reports that are coming into Team St. Clair are accurate, a lot of people aren't following the recommendations of the state. Herb, the reason we were a little late today, I got a call from Senator Chris Belt, the senator from our region, state senator from our region. Just wanted to make sure that Team St. Clair, everybody that's watching, remembered that tomorrow the DCEO website goes live for the business interruption grant. It's a large grant. There are dollars set aside specifically for downstate Illinois, and it's the kind of grant that it's first come, first serve. There's a lot of money there, but it will go fast, so we encourage everybody to get in and to apply for those dollars. They go to small businesses. They really are targeted for those businesses. Currently, I think there's about 25 businesses that are benefiting from the first round of those grants that went out earlier in the year, and they're anywhere from $10,000 to $20,000 a grant, which is good money. And this time they're targeting, they have categories for all sorts of businesses. I saw the movie theaters, amusement places, they have a special compartment, and a number of other establishments will have that. So I think what it means is the playing field's pretty level, and if you need help, if you're truly in need and need one of those business interruption grants, tomorrow is the day they go live, and get in there and apply.
Well, and I said it the other day, we understand because we hear it, businesses are calling and we hear it every day, but they have got to take the initiative now, get in on this program. They're not, the state, the county, your municipality doesn't know what your needs are. You do. So take advantage of this. If you don't help yourself, then, there's nothing else we can do. I mean, Senator Belt took time to call and say, hey.
Representative Hoffman, I mean, we
Yes.
were on the call the other day when all of our, every state representative and state senator was on a call with the state. And to the person, they all said, you've got to remember that Region 4 has all these restrictions and all the businesses are required to follow the rules. So we need to have more and we need to receive more of the funding because we're impacted more than the rest of the state.
Well, and the day started off with us here. One of our citizens had sent a message needing some help with a fire bill, with rent. I was able to hook her up with Mr. Stubblefield, and just before we went on the air, I got an email back from him. He was able to help. So, if you need help, there are places out there. Mr. Stubblefield from IGD has been on here numerous times, as recently as last week, announcing what they've done in the past, what they intend on doing in the future. So for those of you naysayers out there that says St. Clair County isn't doing nothing, there was this message on here a while ago about lies and fake numbers. Take that someplace else if you would. Team St. Clair, I appreciate yous that are on there letting those type of people know that we are here every day doing the best we can. We're not making these numbers up. These numbers is what the health department gets provided to them. They don't just reach into a box and pull out a number. They provide them to us. We're here every day doing our job by bringing you the latest information to try to help people make the right decisions. And many of you, Team St. Clair, I mean, the list, I quit trying to keep a list of all the Team St. Clair members out there. It's as long as this table. But for those of you naysayers that think that it's fake, it's phony, yeah, the numbers are looking good now, but you heard the chairman say, because we are keeping track of what these numbers are doing, we are going to see a spike by the end of the week. Now, how high, we don't know yet, but we're going to wait and see. We told you that from the Labor Day weekend. We were anticipating that. We did that over the 4th of July, over the Memorial Day weekend. So we know what we're doing when it comes to that.
But Herb, I don't want to interrupt, and I shouldn't, but because we're keeping track of the numbers, and Sam, reads the congregate living facility numbers, today 21 out of those 56 new positives were in congregate living facilities. Because Sam keeps track of those numbers, we can make the case to the state, should they want to come here, that a lot of the numbers, a lot of what we saw today wasn't really in the general spread, community spread. It was, we could define where those numbers are, and because of contact tracing, we can point to certain places where COVID is a hotspot right now.
Well, and that's what we've been working on. Last week, Sam provided us that information on the graph that we showed last week on contact tracing. So we're being able to identify where those spots are in the contact tracing. That's what it's all about. But if people, as we said, that's only as good as people are being honest with the contact tracers. And from the report that I saw today that the staff was working on, there's a lot of places out there that this virus has got to. But, if you're not wearing your mask and washing your hands and practicing the social distancing, I don't have the number in front of me, but the social gatherings seems to be where a lot of people are saying they're getting it from, and not having a mask. So we can't tell you enough. For those of you who are wearing the mask, we thank you. You're doing your part to be part of the solution. For those of you who ain't, you're a part of the problem. And you got rights not to wear a mask, but the people who you go around have a right to be safe also. So I'm not going to rant on that no more. 187 days we've been trying to tell you, if you haven't learned now that the mask is our best defense, and washing our hands and washing our social distance, you will never know it. But the one thing I want you to stop and think, 182 people in this county don't get to make that decision anymore. We've lost 182 of our citizens in this county. We had 35 more deaths statewide. Those people don't get that choice anymore. And for those of you who think that people that were in the nursing homes, these long health care terms, they were going to die anyway. That's the biggest BS I've ever heard. If you've got somebody that's in a nursing home, I hope you don't believe that they're in there just to die. I know people who's been in there for rehabilitation. Doesn't mean they get COVID and have to die. So think about that tonight when you're sitting around your table with your family. 182 of our county residents aren't here with us anymore. And if you are too lazy to put a mask on, shame on you. That's my rant for today. Cindy and Daisy will be back to translate this into the Spanish communities, and we'll be back tomorrow afternoon with the next briefing. Thank you.